Hey everybody, Luke Gordon here, and today I have my pelvis model, and we are talking about hip bursitis. In this video, I'm going to talk about what is hip bursitis and also what causes hip bursitis. And then in some future videos, I'm going to share different ways to treat it, so how to get rid of it. But in this video, it's just more informational about what it is, what causes it, so you have an understanding of what it is. So hip bursitis is also commonly known as trochanteric bursitis. That's another keyword that you'll find online, trochanteric bursitis. If you look at a hip, so this is a pelvis here. On the outside of a hip, this is your lower leg here, your femur, there's this bone here that's your greater trochanter. And if you were to feel along the outside of your hip, just down from your pelvis, so kind of if you're coming up the thigh, it's that hard bone, you can kind of hit it with the outside of your hand. You're hitting that greater trochanter. The actual ball and socket joint of the hip, if you can see on the model here, is a little bit farther in, so in this way, and then the trochanter is out here. So what I've done on the model to help explain what's going on with hip bursitis is I've taped on two muscles to the pelvis here. The one here in blue is your gluteus medius, and the one here in pink is your piriformis muscle. So these are two very common muscles that both attach to the greater trochanter. And so when you hear of hip bursitis or trochanteric bursitis, what they're talking about is an inflammation of the bursa. The bursa then are these little fluid-filled sacs that are designed to go between different types of muscle and bone, and they're there to provide a little bit of lubrication, a little bit of support, so that those areas remain comfortable and they move without causing too much friction. So with a hip bursitis or a trochanteric bursitis, it basically just means that over here, one of the bursa underneath the tendons is inflamed. So that's the basic definition of hip bursitis or trochanteric bursitis. I do want to go a little bit deeper though, because I think there's more to it than just that. I think that's just an oversimplification of it. Because oftentimes what you hear is just it's a bursitis, it's the bursa being inflamed. But I would tend to disagree with that and say that more commonly it's actually the muscle tendons themselves that are inflamed. Now you could argue that it's just semantics or it's just terms. Well, the bursa is inflamed, but it's right by the tendon, so now the tendon's inflamed, and they all kind of go hand in hand. So maybe it doesn't matter that much, but the point I do want to make though is that you have some major muscles that are coming in to this greater trochanter and inserting on there, meaning that's where they taper down into a tendon. And oftentimes with the bursitis, what you're going to find is that you actually have a muscle tendon issue. So keep that in mind, because now we're going to talk about what causes a hip bursitis. So if we talk about these muscle tendon issues, you might just actually call your hip bursitis a tendinitis or a hip tendinitis or a hip tendinosis, depending on the state of those tendons. Now, I've got videos too on tendinitis versus tendinosis. If you want to kind of go down that rabbit hole and learn more about that, you can. But either way, stick with me. We're talking about a tendon issue. So the bursa is inflamed, the tendons are inflamed, and we're going to eventually try to get rid of it. But again, in this video, what's causing the inflammation? That's what you want to ask yourself. Why is it inflamed? Because if you're looking to get rid of your pain, your hip pain, you want to know why it's there in the first place before you can get rid of it. So several things can cause inflammation there. Let's just kind of rattle them off. You can have overuse of the muscles. So if you're overusing the hip and the muscles, over time you can get irritation there. Again, the bursa can get inflamed, or the tendons can get inflamed, or both. It's just going to cause inflammation. So you could have a gluteus medius issue, again, piriformis issue here, one of those deep kind of hip rotator muscles. So that could be one of your issues, is that there's muscle overuse. What I would piggyback on that is that typically people that come into the clinic with this type of hip issue, the tendinitis issue or the bursitis issue, is that they have weakness. So that's a really big one. That's going to come into play later on during treatment techniques. But weakness of these muscles can lead to irritation as well. Other things that can cause hip bursitis, you look at underlying inflammatory conditions like gout, rheumatoid arthritis can often have connective tissue disorders as well. So any of those inflammatory conditions can cause hip bursitis as well. And then the big one that I want to focus people on too is that you can have mechanical changes throughout your body. Say you've got an IT band issue further down the thigh, or you've got a foot issue or a knee issue. Any of those things that are going to affect the way that your alignment is up at your hips and pelvis, or the way that you bear weight. Let's say you've got one bad leg and you're shifting your weight over to this leg. Now you've got overuse. So look deeper into those underlying factors as well that can just be throwing off your balance and your mechanics. If you go just above your pelvis, of course, you've got this area that we all love. You got your low back, and you've got issues with lower back pain, SI joint pain, scoliosis potentially. All of these things up the chain can also affect the way that your hips are aligned and the way that your muscles are being recruited and potentially being overused. Or if they're weak and they're overused, that's really the recipe for disaster for most hip bursitis issues. And again, I keep doing my air quotes, sorry, because a lot of times I don't think of it as bursitis, I think of it as tendonitis or tendinosis if it's more chronic. So again, that is hip bursitis in a nutshell. In terms of what it actually is and what causes it. I'm going to make some videos in the future that outline more and detail more how to actually treat it. So I'll link that at the end of this as soon as those are ready. I'll link that video to the end of this video. And then if you have any questions, of course, you can leave them below. Or if you just want to leave me a nice comment, say you like the video, I would appreciate that too. So there you go. Look for more videos in the future on hip bursitis. And I hope that helps for now. Thanks for watching.